My name is Alejandra Reyes, and I will be doing my final presentation for my English 112 class, section D6H. For my project, I chose to write about abuse in long-term care facilities because I have been a certified nursing assistant for a few years, and I have been able to work in various nursing homes to know that something that commonly occurs is abuse. So I'm glad I got the opportunity to further research what causes abuse, what are some solutions, how abuse can manifest. I found through my research that some of the causes were burnout and stress for employees because it is very hard to take care of high needs individuals, especially when there is a limited amount of employees. Sometimes you will have a certified nursing assistant taking care of more than 15 patients at a time, and that is very difficult when you are only one person. You have two hands, yet you have to take care of all these needs these individuals have, like taking them to the bathroom, feeding them, doing basically everything for them. So that's very difficult, and that sometimes can lead to aggressiveness from the nursing staff or abuse towards the residents, and oftentimes it will mainly lead to neglect. Another cause can be not enough training, not only for the nursing staff, but also for all those individuals employed in a nursing home, like the maintenance, housekeepers, cooks. They really don't remain as alert as they should, and I think something that might cause that is because they do not have training in what signs and symptoms to look for when abuse is occurring or when they think abuse is occurring. The last cause would be a limited family involvement. I interviewed some nurses, and I found that they would treat residents differently depending if the family is involved or not. Sometimes what happens in nursing homes is you have a lot of residents that have advanced dementia. So they lose the ability to communicate properly, and that can lead to somebody taking advantage of them because they can no longer speak for themselves. And so as caregivers, we're there as often as we can be with the resources we do have, because sometimes, again, like I said, there's not really as much staff as there should be. So we can sometimes look over the fact that they're being abused, not notice it because we're so busy. And when the family is involved, they're usually the ones that will notice little things like a scratch, a bruise, or if the family member's acting out of the ordinary, they're the ones that will speak up because they know that individual personally. And so that is a very big cause of why abuse might continue to occur or might be allowed to continue to occur. Some solutions would be more training for anybody employed in a long-term care facility, just letting them know what abuse is, how abuse can manifest. Abuse can be physical, emotional, financial exploitation, or it could be neglect. Knowing who to report it to after you suspect that abuse is occurring is very important. Another solution would be higher consequences for the administrators. Sometimes a lot of these abuse cases will lead to death. And again, like I said, if the family isn't really involved, it's difficult because the only ones that will speak up for that person that might have died due to abuse will be laws, regulations, state laws, federal laws. And so they might fine the administrators, but really the fines are very low, especially when you're talking about somebody's life. And so creating higher fines for administrators might prevent that a little bit. And then the last solution would be to bring more awareness. That is important to let everyone know around you what abuse is, how to prevent it, and basically how to take care of yourself in order for you not to create abuse or, be abusive towards someone. That's very important. And so I'm glad I was able to research all of this.